Now, I want to look at two types of deformities that could also actually occur around the wrist. And this is the Dina fork deformity. Then we also have the Spade deformity. So the two of them, we look at them and you guys will get to look at the differences between them. So this is basically how to repair them. You can pause to observe like how to realign the bone to fit in, you know. So dinner fork deformity or spade, they call it the garden spade. They're actually classic wrist deformities. They occur around the wrist. So this is dinner fork, this is spade. So let's discuss. So dinner fork deformity is a characteristic wrist deformity, and what you are having there is something is actually what your hand is resembling the shape of a dinner fork. You know, so you can see it: dinner fork deformity, garden spade deformity. So causes is usually due to Colles fracture, which is fracture of the distal radius with dorsal displacement of the distal fragment. And usually comes in when you fall on the outstretched hand. So clinical features a lot of pain, swelling and bruising at the wrist. And of course you're not able to use the wrist like you should. And also visible dorsal angulation of the wrist and the hand. Okay. Treatment is for stable fractures, close reduction and cast immobilization. Unstable fractures, surgical fixation using all those plates, screws, and external fixations. Alright, I see the difference. So, how about spade, garden spade deformity? It's wrist deformity and it resembles the shape will be resembling that of a spade, you know. So, causes usually due to Smith fracture, where there's fracture of the distal radius with volar displacement. So, it usually occurs when there's fall on the flexed wrist or probably a direct blow to the back of the wrist. So this one too, there's pain and there's visible angulation. The hand is displaced forward relative to the forearm, and there's limited wrist mobility. You're not able to use your wrist like you should. So treatment is close reduction and cast, and also surgical fixation where they can use internal fixations or external fixations for unstable fractures.